So as of yesterday, we have 58,241 confirmed cases of COVID-19 and 5,595 deaths. We are still, as the governor mentioned, on an encouraging trajectory across the state. And while there are regional differences, we are seeing continued general rates of decline in cases and deaths. The northern lower peninsula, the Traverse City area, as well as the upper peninsula have continued rates of below 5 cases per million people per day. The Lansing region now also has a rate of under 7 cases per million people per day. The Detroit, Kalamazoo, Jackson, and Saginaw regions are all seeing less than 20 cases per million people per day. And the Grand Rapids area stands at 27 cases per million people per day. However, they are in their second straight week of a decline in cases, which is good. And across the state, the percent of tests that are positive remains at about 5% over the past 2 weeks. So while we must continue to monitor the data, because of these positive trends, we are able to move forward on a regional basis with the next phases of the My Safe Start plan. I'm also pleased to announce that today we will be releasing a new and improved MDHHS website, providing more information on both confirmed and probable cases of COVID-19, total antibody test and diagnostic test by county, and we're making the information easier to visualize. So I encourage people to continue to go to our website, www.michigan.gov/coronavirus, for the most updated information. We will continue to work to improve our data reporting to make sure we are as accurate and transparent as possible. As we move forward with reopening the economy, I want to stress that the risk of COVID-19 is not gone. People must continue to wear a mask in public. Make sure you're maintaining a 6-foot distance from yourself and others if you are in a public space. Clean frequently, touch surfaces often, and wash your hands. Although the risk levels are going down, it does not mean it has gone away, and so we must remain vigilant. And particularly those who are elderly or have chronic underlying medical conditions like heart disease, diabetes, COPD, or weakened immune system, strongly consider not going out unless you absolutely must. Part of our strategy, as the governor mentioned, for reopening the economy is to expand testing as well. That's really the only way we're going to know where the disease is in our state so we can stop the spread. I'm very excited that over the past week, the state has averaged over 15,000 diagnostic tests per day. To put that in context, during the month of April, Michigan was averaging about 5,000 tests per day, a third of the testing we are doing today. The state is now looking towards our next goal of 30,000 tests per day, a robust level that would help us identify any new cases and swiftly contain the disease. To reach that level, we are strongly encouraging Michiganders to get tested. We've recently expanded our testing criteria, so anyone who has symptoms, no matter how mild, should get a test. Anyone leaving their home for work can get tested, and especially people who are coming into close contact with other people in their jobs, or those who work in settings where there have been outbreaks in the past should be tested. It's easy to get a test. You don't need a doctor's order before you go, and there are dozens of sites offering testing at no cost to you. There's over 250 testing sites operating in Michigan, so please visit michigan.gov/coronavirus test or call the MDHHS COVID-19 hotline at 1-888-535-6136 to find a test site. Contact tracing is another critical part of our effort to respond quickly to the virus outbreaks and limit the spread of COVID-19 in the state. We've seen strong increases in our capacity of our contact tracing system. We have over 400 people actively working in the state's centralized contact tracing platform. Our contact tracers reach out to every person with a positive test within 24 hours. Our goal is to actually speak with someone at least 98% of the time. But right now, that number is only about 60%. This highlights the fact that we really need everyone to pick up the phone when they are called by a state or local health department staff. When we call you, we will always protect your information, and we will never ask for things like money or credit card information or a social security number. But it is important that we speak with you about your contacts, especially if you have tested positive for COVID-19. We may also be calling you to tell you we've been in close contact with someone with COVID-19 and that you need to get tested or you need to self-quarantine to prevent the spread of the disease to others. So please do answer the phone when we call you so that we can do this important public health work. COVID-19 will be with us for some time, and we have to get used to living with this virus amongst us in the safest way possible. This is a marathon, it is not a sprint. So wear your mask, wash your hands, maintain social distancing, stay home if you are sick, check on your elderly family members, and see if you can go pick up groceries for them so that they don't have to go out themselves to shop. If we all do this well, we'll be able to continue moving forward and not backwards with re-engaging the economy. So please remain vigilant and remain patient as we all fight COVID-19 together. Thank you.